When we talk about intimacy, relationships, and sexual performance, one of the most common concerns that men quietly struggle with is the ability to last longer in bed. It is a subject that carries a lot of shame and anxiety, yet it is incredibly important to address it in an open, compassionate, and science-backed way. Many men are silently worried that they do not meet the expectations of their partner, or they fear that they may be judged for not having enough stamina. The truth is, lasting longer in bed is not simply about endurance or masculinity, but about a combination of psychological, physical, and lifestyle factors that can be improved with the right strategies. Research shows that premature ejaculation is one of the most common male sexual health issues, affecting about 20 to 30% of men worldwide, according to studies published in the Journal of Sexual Medicine. It can have significant effects on self-esteem, relationship satisfaction, and overall quality of life. The encouraging part is that science has identified multiple proven methods that can help men improve their stamina and enhance their sexual experience. These methods are not about quick fixes or gimmicks, but about real, evidence-based strategies that work with your body and mind to bring better control, better satisfaction, and stronger intimacy. One of the first proven tips to last longer is learning the art of mental focus and mindfulness. Many men ejaculate quickly because they are overly anxious, overstimulated, or trapped in negative thoughts about their performance. Studies from Harvard and Oxford on mindfulness training have shown that practicing mindfulness can help regulate arousal levels and create better awareness of sensations in the body. By staying present, breathing deeply, and consciously slowing down during intimacy, men can increase the threshold of arousal before reaching the point of no return. A research article published in Behavior Research and Therapy highlighted how mindfulness practices significantly improved control in men dealing with premature ejaculation. This means that when you train your brain to focus on the present moment instead of worrying about the outcome, you gain more control over your body. Another important tip is the start-stop technique, which has been widely studied and validated. This method involves stimulating yourself or being stimulated until you feel close to ejaculation, then stopping all stimulation and waiting until the urge subsides before starting again. According to studies in Sexual Medicine Reviews, this technique helps train the nerves and muscles involved in ejaculation to delay the climax. Over time, it conditions your body to tolerate higher levels of arousal without automatically releasing. The key here is patience and practice, and research supports its effectiveness when practiced consistently over weeks or months. Closely related is the squeeze technique, another well-researched behavioral method. This involves applying firm but gentle pressure at the base or head of the penis when you are nearing climax. A clinical review in the British Journal of Urology International reported that the squeeze technique has been successful for many men in extending duration and improving confidence. This works by slightly reducing blood flow and desensitizing the stimulation, which allows you to reset and continue longer. It is a method that requires good communication with your partner, but it can be both effective and even add playfulness to intimacy. A fourth proven strategy comes from strengthening your pelvic floor muscles through Kegel exercises. These are the same exercises often recommended to women after childbirth, but studies have shown they are just as beneficial for men. Research published in Therapeutic Advances in Urology found that men who practiced pelvic floor muscle training significantly improved their control over ejaculation and erectile function. By regularly contracting and holding the pelvic floor muscles, which you can identify by trying to stop your urine flow midstream, you build strength and endurance in the very muscles responsible for controlling ejaculation. Just 5 to 10 minutes of consistent daily practice can make a noticeable difference within weeks. Another powerful tip is understanding the role of sexual positions. Some positions naturally increase stimulation and bring faster ejaculation, while others allow for more control and pacing. Research from the International Journal of Impotence Research has indicated that positions where the man is less stimulated or can slow movements tend to increase endurance. Experimenting with different positions that allow pauses, slower penetration, or more control can give you better timing and help extend intimacy. Breathing techniques also play a major role. Shallow, fast breathing often accompanies anxiety and overstimulation, which pushes the body toward rapid climax. Deep, slow breathing, on the other hand, activates the parasympathetic nervous system, which promotes relaxation and control. A clinical trial published in Cognitive and Behavioral Neurology demonstrated that men who practiced controlled breathing experienced improved ejaculation latency times. By inhaling deeply through the nose, holding for a moment, and exhaling slowly through the mouth, you can literally calm your nervous system and reduce the urgency that drives premate. Your climax. Another science-backed method is the use of desensitizing products, such as topical sprays or creams that contain mild anesthetic agents like lidocaine or benzocaine. Clinical studies have confirmed their effectiveness in delaying ejaculation by slightly numbing penile sensitivity. For example, a study in the Journal of Urology showed that men using these products were able to increase their duration significantly compared to those without. However, it is important to use them properly, avoid overuse, and communicate with your partner to ensure comfort and consent. Lifestyle factors also cannot be overlooked. A balanced diet, regular exercise, reduced alcohol consumption, and quitting smoking all directly impact sexual stamina and control. Studies in andrology and the American Journal of Lifestyle Medicine have shown that men with healthier body weight, better cardiovascular fitness, and lower stress levels perform better sexually and report longer-lasting satisfaction. Foods rich in zinc, magnesium, and omega-3 fatty acids, such as nuts, seeds, fish, and leafy greens, support hormonal balance and nerve function. Exercise improves blood circulation, testosterone levels, and stamina, all of which are crucial for sexual performance. Even something as simple as consistent sleep quality, as reported in research from the Journal of Sexual Medicine, has been linked to better sexual endurance. Communication with your partner is another essential tip that science indirectly supports. Performance anxiety and secrecy can worsen premature ejaculation, while openness and understanding can reduce pressure and improve control. Relationship studies consistently show that couples who communicate about their sexual needs and challenges report greater satisfaction and improved performance. When you feel emotionally safe, your body naturally responds with more confidence and control, reducing the anxiety-driven urgency to climax quickly. Lastly, professional help should never be underestimated. For men with persistent challenges, consulting a urologist, sex therapist, or medical professional is a proven step supported by countless clinical outcomes. Cognitive behavioral therapy, prescription medications like SSRIs under medical supervision, or specialized counseling have all been validated in peer-reviewed studies as effective treatments for premature ejaculation. Seeking help is not a sign of weakness but of strength, and the science supports HAT professional intervention can dramatically improve not only performance but overall quality of life. When we bring all of these tips together, what becomes clear is that lasting longer in bed is not about a single trick or secret, but a combination of training your body, calming your mind, nurturing your health, and building intimacy with your partner. Science shows us that mindfulness, behavioral techniques like start, stop, and squeeze, pelvic floor exercises, controlled breathing, careful use of desensitizing methods, lifestyle improvements, and open communication are all proven strategies. These approaches work not just by extending sexual performance, but by enhancing confidence, intimacy, and satisfaction for both partners.
Lasting longer in bed is not about chasing unrealistic standards. It is about creating fulfilling, connected, and enjoyable experiences. The research supports that with patience, consistent practice, and the right mindset, men can transform anxiety into confidence and short moments into lasting intimacy. You are not alone in this journey, and there are real, effective solutions backed by science that can help you regain control, strengthen your relationships, and experience the deep satisfaction that healthy intimacy brings.